Here we are at King's Restaurant, another episode of Something to Talk About. Today, I'm catching up with a young man who I met a long time ago, but now he's pretty special, and he's launching a new foundation, and we want to help him out. We're going to talk about that on Something to Talk About. Welcome to King's Restaurant in Tamooning, and of course we got the seafood sampler because it is after all Lent, and our fruit bowl, thanks to the fine staff at King's for putting up with us every week. I said he was a person I met when he was a young man. You were a young man.
Yes, high school.
In high school.
That's right.
Janice Rodriguez Jr., his lovely wife, Lena Calvo Rodriguez, we were both serving at Blessed Diego Church as we basically read. That was our thing. Yeah. We were lectors at the church, and we sat together every Sunday. That's pretty much, because we were both assigned to the same mass. He was young enough to be my son, but
That's right.
but you went to school with my nephew Eric, right?
That's right. That's right.
So I met him back then, and then watched him flourish into where he is now, a family man. Are you you guys are grandparents?
No.
Okay.
Not yet.
Sorry. Their hearts skipped a beat there on that one. But going from business into politics and the launch of your new foundation, I made the point early on that you have used the words Toda Guam, I've always associated with something with political.
Yes.
But you have just clarified for me that hasn't always been the case with the name.
We've actually used Toda Guam for our business. When we first started our business, this was in 2007, I believe, 2006. And so it was a small wholesale business my wife and I did. And then when we opened our store, we named it Toda Guam Store. And it was made in Guam products that we were selling in there. After that, that's when I used it for politics, when I ran for senator. And it was really about those two words for me were so powerful. Toda Guam, everything Guam. And so it was who I was. It was who I wanted my service to be in office. And so now, as I'm in the point in time where I'm looking ahead and saying, well, this is something I'm going to take, and use and moving on to help our community outside politics. And so that's why with this foundation that we created, to the perfect name for it, and it means a lot. Having the name means a lot. Is Toda Guam is really what this foundation is about.
Yeah. So you launched a foundation, and now you're going to try to separate the name from your political career. All right.
So we told our guys, hey, anything we're doing for ads or anything, we're not using Toda Guam anymore.
Yeah. All right. We'll talk to you about what the slogan will be, but the Toda Guam Foundation, though, was built on what? I mean, you've been doing a lot of work in the community, and people have associated you with health issues anyway.
Yes, yeah. And so, this is going to be my 7th year, at the end of this term, 8th year in legislature as the Committee on Health. And when we take a look at really the issues and challenges we have with healthcare, we always, we've always looked at just the hospital, right? Because that's something we always have to fix. The challenges are always there. But when we really took a look at the root of the problem, it was access to care, access to primary care, access to prevention. So the work that we're doing in the legislature now, is parallel to what this is that we're working on public policy to get people more access to health care, to health insurance. At the same time, when we launched this last year in August, it was about taking the bull by the horn and just making it happen. Taking the services out to to our community, and so that's what we did. We bought this this trailer. It has 3 exam rooms. We use 2 exam rooms, and one is like a triage waiting area. And we've taken it out, and we've serviced over 1,000, almost 1,500 individuals already. With different services. We try to bring along public health with us. We bring along the nonprofit organizations that provide services. And so we saw how effective this outreach could be. And so we're saying now, if this is how we're going to address the root of the problem, then we have to help the government in doing that.
Okay. Well, that's all part of the regular. I mean, your career as a senator and having interest in health issues. The fact that you run around town with this mobile unit has probably got more of you written on it than anything, right?
Yeah, if I could, I want to thank her, because when we first did it, she told me, "What are you doing?" Because it was our own resources. I said it was my chief of staff, Chuck Tanner. He bought this from a surplus, from the federal government surplus, right?
Yeah.
He had it parked for about a year or two in his house. And I told him, I said, man, this is exactly what I want to do, of figuring out how can we do this. And so that's when I worked it out with him, told him I'll buy it from him, and we started moving.
Right.
But then when I told her I have to pay this amount, and this is the things I got to do, it was, I had to.
Kind of stunning, huh?
I have to admit, maybe 2 years before we purchased the clinic, we were driving around town one day, and he said to me, one day I'm going to have a mobile clinic. And he says a lot of things to me, so I'm just like, I didn't even think about what a mobile clinic could be. And I said, okay, whatever. And 2 years later, he says, hey, Chuck has a mobile clinic. And I'm like, okay. And he took me to it one day to see it, and I was like, oh, this is a real clinic on wheels.
Yeah.
And he's really soft at breaking things in. So it wasn't until like a week before he decided to take it out, and he says, we're going to buy it. And I said, what do you mean we're going to buy it? We're going to buy it. He's selling it. He's selling it, and this is what I wanted to do. And I said, okay, kind of running with it. And then we set up to have the first outreach. And I remember one Sunday afternoon, we go to where it was getting fixed, and we spent like hours cleaning it. And I said to myself, what are we doing? And we're
Can't this be a food truck? We can make money off of it.
And he's changing tiles, and I said, oh, okay. And then we have to put it out the next day,
Yeah.
And he kind of had like a little open house for it, and ever since then it's been pretty amazing. We take our kids along with us everywhere, and to see how fortunate they are, and then to see what the clinic services, I don't even think I imagined what we're servicing would be the services of it.
Yeah.
Before that, so to see it is pretty, special.
It's interesting too, because a lot of us don't see it, and the it is impoverished families. The it is people who don't have the means or the resources to get some of the basic stuff that we take it for granted. Your kid gets a sore throat, you're off to the doctor without a second thought.
Absolutely.
And you go, oh, do I have the $10 for the copayment? Which sounds so ridiculous and embarrassing.
Yeah, you're
So, and
absolutely
I'm
right.
sure that's why I wanted to go out with you, because I think
you
that
gotta see it.
you have to meet the people.
Yeah, you have to, and see the our people that come out. It puts us in tears sometimes, because you're right. We're so fortunate. Our kids. My boy starts coughing, I say, I'm taking him to the urgent care, because we could. We have that access, right? Others, we've taken nurses and doctors with us. They're surprised. They've seen 7-8-year-old kids that have never been immunized. The first immunization was probably when they were born, and after that, never immunized. And so these are the kids that play with our kids at school, in the parks. And so,
and you
we
don't
have a
know
serious
what's
problem.
underneath whatever.
Absolutely.
Yeah. They don't let on. You don't really know.
Yeah.
They don't really know. It hit me the very first outreach we did, which was in Agana. We set it up, and people were signing up to do it, and there was this family, and we had several services like vision exams, school physical, immunizations, TB, right? And she had like 5 kids with her, and she looks at the form and she said, so which one could I get? And I said, you can get everything. And she said, but I have 5 kids. And I said, but if they need everything, she can get everything. And she said, oh, it's okay, I'll just do one. And I said, why would you just do one when you can get it all? And she said, I don't have money. And I said, we're not asking for any money, get it all.
She thought she had to pay.
She thought she had to pay. And then it dawned on me that even to ask a question is intimidating.
Yeah.
And so they would just, to get by, just take one that would. And then it hit us, and I said, there's just a whole bunch of people out there that don't have this access. And even just because as simple as not being able to ask, you know what I mean? maybe
Yeah.
they've been turned down before or something. I don't really know, but
The government is a big bad place when it comes to stuff like this, though,
really
right?
is.
I mean, you've seen it more in your capacity as a health advocate. That the government, we do fail in that
Yeah,
way.
and you know, when we tell them if they're on MIP or Medicaid, or if they don't have anything, we tell them if you get sick, you want to get something done, go to the community health centers, right? But they're swamped. The community health centers are swamped. I think they only open up to about 5 or 6 people a day for walk-ins. Everyone else is through appointment. So they get discouraged when they go there and they're the 7th person, and they go there at 6 in the morning, I hear sometimes, just to be the first in line.
and they had to catch a ride.
Yeah,
you
and
know,
so it's
you know what I
difficult.
mean? Like
Oh,
there's so many factors to it, and
There's so many reasons for you not to even
not to
attend.
do it.
Yeah.
Exactly.
So when we take this out now, we try to give even incentives. We got a gym that gives us free membership cards that we give out. The people that come, you know, you come and do your immunizations. We give out these gym memberships. We have other nonprofits that come and provide, you know, just some gifts, right, just to incentivize people. But what we're doing now, Patty, is all reactionary, and when we see it, that's why we decided to do this foundation to expand it. Because now, like when Dr. Garrido sees a kid and says, "Oh boy, this is something big. You need to go get a MRI or an X-ray, or you need to go to the hospital." They look at us and say, like, "Okay, but
What now?
You know, we can't afford to go there." You know, so this foundation now is going to expand and be able to continue that service for them. Either it's through getting them insurance coverage or getting them to get the services that they need.
Well, we're going to take a break here. When we come back, we'll talk about the expansion of the services and then how you're able to do this. You've just started the foundation,
Yes.
which means that you really haven't generated a whole lot of money. So I guess the obvious question is, you know, how much are you giving up of your own personal finances in order to do that, or how much are you giving up? I guess larger to say, or your kids are doing without. That's what we're going to talk about on Something to Talk About. We'll be right back. Welcome back with Senator Janice and Lena Rodriguez, talking about Toda Guam, which is a new foundation. It's kind of new. I mean, we all have heard of Toda Guam, but it's a foundation. Well, I guess we want to find out how you're going to expand it. We already know that you've got a mobile health center that goes around the island. Is it a regularly scheduled?
It's a regularly scheduled.
Really? Is it
so
every weekend, or you?
Initially, when we started, we decided, okay, we'll put it out every second Sunday of the month. And that's our regular schedule, but then we get calls to put it out more often. So I think we're averaging about 3 outreaches a month.
Wow.
Yeah.
How do you get that many healthcare providers to come on board three
We created
times
a
a
trap.
month?
We created a chat group, and anyone.
Oh, you said
we-
trap or
I know
trap?
both.
Yeah, both. So we
Both.
created a chat group because it's hard to like call and you know everybody's on their phone, so that's made it a lot easier.
The
And
doctors and nurses on
minute
this
Or
group.
all on that. It's like
and
a
then they
WhatsApp
have their
chat
network
group.
group too, so if they didn't put them on the chat group,
Oh, I
and then
see.
they're like, okay, we'll have this doctor cover for us to stay.
The doctors that you're getting are mostly pediatricians or internal medicine?
Pediatricians,
Internal. We have some-
general practitioners.
Okay.
And then just recently, about a few months ago, we got public health, community health centers involved. Linda DeNorsi.
Yeah.
Because that's the work that they do, right? And then they get federal grants to do that. So we said, look, that's your function, that's your mandate. Come
You're
with
just
us.
providing literally
A
a
venue.
vehicle.
Yeah, a
Yes.
vehicle and getting. I mean, when we go out, I know that they're surprised because people come. I mean, we get volunteers to go out to canvass the village wherever we're at and tell them, hey, we're going to be at this location this day, and we even got the truant officers, calling us, telling, okay, you need to go to this area because we're having a lot of
The school
truancy.
nurses.
Oh, no kidding.
And the problem they're seeing with truancy, a high number of them, is because they can't get their physicals. So, at a certain point in time, when the beginning of the school year, you can't go to school unless you get your physicals, right? And so they're seeing that these families can't do because they can't afford to get the physicals. So I know Astumba was a big problem, and so we went out there, and that was the largest. We had over 350 people come out.
So that was a high need area.
That's a high need
It was a
area.
high need area.
See, because everybody thinks it's somewhere down south, but really the larger.
We've done 2 or 3 in the south, and then Estimbo. You're right. We were heading back. That they were our first northern outreach, and then it was a truant officer that kind of gave us a call and said, "I have a whole bunch of students. Can you guys come do it?" And we said, "Okay." So we average 4 hours for an outreach, and that's pretty decent for the volunteers, right? We don't want to overwork them. And that outreach turned out to be like an 8-hour outreach.
Wow. So the volunteers are coming from public health because they have the authority to issue these documents, or does it,
No, well,
it doesn't
we get nurses from GMH that come out. We get nurses from the private clinics. With the arrangement we have with the community health centers now is that they come out and bring their immunizations, their flu shots or whatever shots, vaccinations they have. So we were able to schedule them at times where they're already scheduled to come out for an outreach.
Yeah.
So we say, hey, come out and do it with us because we're getting the numbers there. There's times that they're not able to join us. That's when we now tap on our network of volunteers and doctors.
Well, because you're out there and you're sort of a first line to see what kind of health issues are out in the public that are unseen, then you're probably running across some more serious issues, right? I mean, if you're not going to the doctor for these things, you're not going to the doctor for the larger things.
There was an incident over when we were at the Dedito Sports Complex. Dr. Carrera, one of our dedicated volunteers.
Felix Carrera, is that the one?
No,
that was Carrera.
Yolanda Carrera.
Yolanda.
Yeah, the
Okay, we're gonna
pediatrician.
scratch that from the.
Yeah, so
Edit that one out, guys.
she was there. They saw it wasn't a child; it was an adult that came in with, I guess, some sort of disease that she thought was highly contagious. So she told us we have to shut down the mission, call the ambulance to transport that individual to GMH, and we have to sanitize. So that's what we're seeing out there in the community. It's not just, we thought, okay, we're just going to do the prevention stuff, right, and maybe some primary care. But now we're seeing people that come in for serious illnesses that. That's why I was saying now it's reactionary right now. We want to stabilize it.
The ultimate goal is to get our community to preventative care, especially the uninsured and the underinsured, because they're the ones that don't go out and seek this all the time, right? But he's right, we're still at reactionary care, and I think it'll be a while before we actually get to preventative.
This is your first time out.
Yeah.
This is, I mean, you do this, and I know the Guam Medical Association as well does this.
That's right.
But the efforts are there, and there's
right.
enough community members. There are enough people that live on Guam
That's right.
that the effort it has to be much larger.
Yeah, and this is just the medical side.
Yeah.
We've seen kids that need dental, a lot of dental care. And I told, when I first did this thing, I said, okay, we're gonna do dental chair. We're gonna put it in there too. And they told me I'm crazy because there's not enough space. We don't have. So that's the other goal, is that we have dentists that say they're gonna come out and support it and help us out. We just need the ability to take it out there, and get another.
So the
trailer.
question, I guess the question was, is that this costs a lot of money, I'm sure. You don't have any, I mean, what's your backup? I mean, do you get federal grants? Can you apply for federal?
We actually just filed and got our papers 2 weeks ago.
Oh, okay.
And so we've been operating out of our own pocket for the last 6-7 months.
And there was a couple of people that messaged us on Facebook, right? Really great people, and said, we know what you're doing. We want to buy you a box of bandage, a
bag of supplies. That really goes a long way. We had a few doctors that they'll be at our clinic and they'll realize, like, you don't have tongue suppressors, you don't have
They'll
this.
run to their clinics.
They'll run to their clinics, or they'll send
it.
a nurse and they'll bring it down, or we're in the middle of clinic and we have 300 patients and only 2 ear thermometers, right? So we'll run to Payless Superdrug and get a couple more. Yeah, so we've been operating like that, which is, I think we could be a whole lot more efficient if we had a system in place.
Yeah. So we've reached out to one of the great organizations on Guam Cancer Care, Terry Quavo, who put that group together, and I've seen the work that they do. We actually, when people come in our office with some cancer-related issues, we actually drive them to Guam Cancer Care and say, this is the organization that can help you. We saw what he did, so we asked him, how can we mirror kind of that structure? So he helped us create this foundation now. And so the goal is to raise money, to go out for grants, and to really put a structure in place so that we can have this continue and make it sustainable. for the future. Because I really think, looking at the work that I do in the legislature, that what we need to do is get to the root of the problem. And the government can't do everything. I realize that. We can do so much, but if we all come together, GMA, as you said, goes out and does this, community come together and tackle the root of the problem, I really think we can achieve what it is we're looking for.
So you have a fundraiser, which is a perfect way to start, and that's to launch the foundation and to solicit, I guess, your guests for donations.
Right.
And then how will the donations be used? What would you specifically? Is it for supplies necessarily, or for a larger?
It would be for supplies. It would be for actually the clinic needs some upkeep right now, right? We've been out for 8 months, and here and there we've gotten the recommendations by the professionals of what we need to add to it, what we still don't have yet, and so that's our goal, is that with this little seed money we can get it out. We don't stop going out to the community because of these things. We kind of just make shifts and keep going.
Yeah.
So it'll help us. It'll definitely help us.
How do you tie this in, I guess, politically? I think that people watching would go, Janice Rodriguez, Toda Guam, those are all these little buzzwords, the fact that you have been talking about the possibility of running for a higher office.
Yeah.
Is this kind of, it would be crazy for me not to ask you.
Sure,
This is laying
fair,
the ground,
absolutely.
the groundwork for something like that.
And that's why I think it was important, if anyone, because this came up when I first launched this last year in August. They said, oh, this is all about politics, about the election coming up. If you ever came to any of these missions and you see the people that come out, these people don't vote. I remember the first time we did it, there was a friend of mine that came and said, wow, look at these people, where did you find them, right? And these people don't vote. And it was never about that. It was about, if you remember, I put together this task force of public and private individuals. We looked at the problem of the hospital. We came up with a report that said, we can't just look at the hospital as a way to fix it, because we've been doing that for 4 decades. We got to get to the root of the problem. And so this is really about that. It's about getting to the root of the problem. I even tell them, I said, with the board in place, I say, what my vision is that this foundation is actually going to be able to help people pay for insurance premium. Because that's the end goal, for me at least, is to get as much of our people insurance so that there's a payer attached to them, so that they have the opportunity to get a yearly checkups. They have an opportunity to take advantage of these wellness programs that insurance companies have. And I said, if the foundation can really establish itself and help pay that employee at a restaurant or a hotel, that the employer offers them health insurance but says, I'll pay 50% and you pay the other 50%. That employee is going to say, if I'm going to pay $50 a pay period for my insurance, or take that money and buy food for my kids, I'm going to take it home and buy food for my kids, not thinking that insurance is so important. And I see it, how important it is.
Yeah.
So we'll always have people that think it's for a different intention. But as long as my mind, my heart knows what it is, then we're going to keep on going.
Well, it was nice to catch up with you guys. Thank you very much for coming.
Thank you so much.
And congratulations on the foundation.
Thank you.
And we look forward to watching this service to the community more often. 3 times a month is a lot to ask of people in the profession to give of their time. But if you're in the profession,
That's it.
it doesn't matter.
That's
Thanks
right.
so much.
Thank you
for
so
joining
much,
us.
Patty.
And thank you for joining us. We will see you on the radio next time.